Bismillahirrahmanirrahim. Assalamualaikum and salam sejahtera to everybody. Topic today is OSA or obstructive sleep apnea, the silent killer. Obstructive sleep apnea or OSA, the silent killer, is characterized by loud snoring. That loud snoring has made the spouse, usually the wife, keep on complaining and push our patient to seek treatment and intervention. Snoring is loud and noisy, so where is the silent? The silent is the apnea that occurs whenever the patient's airway is blocked totally. For the spouse that are used to loud snoring and suddenly apnea occurs, and this causes the silence. The silence is deafening, they say. But most important is that the silence is killing our patients. Sleep. Sleep is a resting state of our body. Tidur satu bantal, mimpi berbeza. That they say. Sleep is essential to protect the mental and physical health of an individual. The function of sleep has not always been clear. During sleep, there are a number of important processes that occur. Sleep plays an important role of the function of the brain by forming new pathways and processing information. Sleep plays an essential role in the consolidation of memory and the selection of important information and stimuli. Sleep is also thought to help clear out toxins that accumulate in the brain. Sleep is also essential in the healing and repair of our cells. Cycles. There are two basic types of sleep cycles: rapid eye movement or REM and non-REM. REM sleep first occurs about 90 minutes after falling asleep. Your eyes move rapidly from side to side behind a closed eyelid. Mixed frequency wave activity becomes closer to that seen in wakefulness at this REM. Your arm and leg muscles become temporarily paralyzed, which prevents you from acting out of your dreams. Everyone dreams, whether it is in color or black or white. The exact purpose of dream is still unknown.
Sleep stages are defined based on the measurement of electrical activity in the brain using an electroencephalogram, or EEG. An EEG represents fluctuations in brain electrical activity and voltage as a waveform of variable frequency and amplitude. The American Academy of Sleep Medicine classifies sleep as consisting of 4 stages. The first 2 stages involve light sleep. When someone begins to fall asleep, they enter stage 1, during which an EEG records low amplitude waves of mixed but mostly high frequencies. Next, the person enters stage 2 sleep. This is characterized by the presence of phenomena on an EEG known as sleep spindles and K-complexes. Sleep spindles are trains of high-frequency waves. The K-complex involves a biphasic wave that stands out from the rest of the EEG. Stage 3 sleep is also known as slow-wave sleep or deep sleep. In stage 3, delta waves, which are low-frequency, high-amplitude waves, make up at least 20% of brain activity. Stage 3 sleep is thought to be especially important to overall restfulness. Next, the sleeper passes rapidly back through stage 2 and stage 1 before entering rapid eye movement or REM sleep. In REM sleep, EEG activity resembles what's seen in stage 1 or restful waking. During REM sleep, the muscles are completely relaxed and limp, but the eyes are moving rapidly. This is the time of sleep when our most vivid dreams are likely to occur. After REM sleep, the person will sometimes awaken briefly, but then will move through the sleep stages again in order. Most people will repeat this cycle 4 to 5 times a night, with each cycle lasting about 90 to 110 minutes.
There are different types of sleep anomalies. Insomnia is a sleep disorder in which you have trouble falling or staying asleep. It can be acute or chronic. Insomnia is a common disorder and affects as many as 35% of adults. Sleep apnea. Sleep apnea is a condition marked by abnormal breathing during sleep. This temporary breathing lapses causes lower quality of sleep and affect body supply of oxygen. There are three types of sleep apnea: obstructive sleep apnea, central sleep apnea, and mixed sleep apnea. There are other sleep anomalies, but it is not the purpose of this presentation to discuss this other diagnosis. Sleep apnea or OSA affects between 2 to 9% of adults. It is characterized by obstruction of the upper airway. This obstruction causes apnea, hypopnea, and snoring.
Of that pathway is in the back of your throat. When you're awake, muscles keep that pathway relatively wide open. But when you sleep, those muscles relax, allowing the opening to narrow. The air passing through this narrowed opening may cause the throat to vibrate. That causes snoring, which many people experience. But in some people, the throat closes so much that enough air can't get through to the lungs. When this happens, the brain sends an alarm to open the airway. Most often, this is associated with a brief arousal from sleep. The brain quickly reactivates the muscles that hold the throat open. Air gets through again, and the brain goes back to sleep. This disorder is called obstructive sleep apnea.
OSA symptoms. OSA is a serious condition which needs urgent attention and treatment. The repeated episode of apnea, if left untreated, causes strain to the heart and lungs, as well as denying the brain and the body the sufficient oxygen during the sleep. It can lead to early onset of hypertension and diabetes, which then leads to heart disease and stroke. For men, OSA can also cause sexual dysfunction and impotence. OSA too result in poor quality of sleep, cause tiredness and daytime sleepiness. This lead to poor work performance, emotional irritation, and increased likelihood of motor vehicle accidents. The patient often wake up at night to urinate. They will complain of morning headache, dry mouth, and sore throat. Several studies have found a strong correlation between higher body mass index or BMI and OSA. Polysomnography or PSG, also known as sleep study, is a comprehensive test used to diagnose sleep disorder. PSG records brainwave, the oxygen level, and heart rate. PSG type 3 is enough to diagnose OSA. PSG type 3 or partial polysomnography can be done at home or in the ward in the hospital. So the patient will be fixed with this machine, and we can see the variable sensors that is applied that monitored throughout the sleep of the night.
Apnea. What is really happening? When the airflow drops to below 50% of normal, this is known as an hypopnea. If you have SDB, the amount of flow limitation you experience, with or without snoring, varies continuously during the night. As the muscles in the upper airway start to relax, the suction effect of each inward breath
tends to draw the soft tissues down towards the back of the airway. Over a series of breaths, the airway progressively narrows and the airflow decreases. There are times when airflow stops completely because the airway is blocked. This is known as an apnea. Air supply to the lungs is interrupted during an apnea. Our model shows obvious signs of an apnea event. The airflow trace changes to a horizontal line for the length of time that the apnea persists. This demonstrates that there is absolutely no airflow, as our model struggles to get air through the collapsed airway. There is no noise at all, which is a particularly dramatic change if the apnea follows snoring. Our model has stopped breathing. An apnea can continue for 10 seconds or more, and in severe cases, for up to a minute or longer. During this time, the heart rate drops significantly. So does the level of oxygen in the blood, since no fresh air enters the lungs to replenish the depleting oxygen. The brain soon realizes that the body is struggling. That is why an apnea always triggers a strong arousal, with severe effects on the body. Our model gasps for air, causing a sudden movement in the noise trace. Brain activity increases significantly. The heart rate after arousal is almost double what it was during the apnea. Our model's rapid breathing increases the airflow and the blood oxygen level begins to rise again. The tongue and soft palate quickly return to their normal position as the airway opens fully. The airflow curve returns to the normal bell shape. With every arousal, your body may move to another position in the bed. But you will probably not remember waking up, even if arousals.
The data from the partial PSG will be collected and then reported as apnea-hypopnea index, respiratory disturbance index, and oximetry disturbance index, and breath statistic. The report of our sleep study will come back as AHI or apnea-hypopnea index. So if less than 5 in night, it is considered as normal. 5 to 15 is considered to mild. It will be mild. 15 to 30 is moderate, and more than 30 times of AHI, it will be severe. For a patient that has a complicated sleep disorder, we might refer to our sleep lab in Hpsf under respiratory physician for a type 1 PSG. Once a patient is diagnosed as OSA, we will advise them to reduce the weight and have a better sleep hygiene. And then the goal treatment are still what they call CPAP machine or continuous positive airway pressure machine, or if the patient is not suitable for CPAP, then surgery might be considered. CPAP, continuous positive airway pressure machine, is an effective treatment for OSA. Positive airway pressure reduces the number of respiratory events that occur as you sleep. These are the different masks that can be applied to the patient. Depend on the comfortability of the patient and the patient choice. You might have seen this, but this is not a CPAP mask, but this is a modified mask made out of snorkeling gear. Surgery for OSA Uvulopalato-pharyngoplasty is the most common surgical procedure for OSA. This method removes excess tissue from soft palate and pharynx. Maxillomandibular advancement or MMA is a surgical procedure which moves the upper jaw and the lower jaw forward. It is usually performed by maxillofacial surgeon. Nasal surgery and tonsillectomy adenodectomy is required depend on our assessment. The study of sleep is still developing and progressing. It is a field of discipline that is still lacking in its specialists and researchers in Malaysia. I am hoping that our doctors start to embark on further research and giving the solution to the problem of sleep apnea. Thank you very much and wassalam.